Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, listeners. It's Lindsay Smith-Rogers, producer of Public Health on Call. Thank you so much for joining us for this season of the podcast. Our last episode of Season 9 airs on May 24th and will return to kick off Season 10 on June 3rd. Next season, we'll continue to dive into some of the biggest public health questions, like how worried should I be about bird flu, and how is access to methadone changing, or what's the story behind the surge in syphilis in the Midwest. Whether you're interested in the systems, science, or solutions behind our survival, Public Health on Call is your regular dose of informed discussion. A big thank you to our talented team of audio producers who spend hours editing every episode of this podcast. Thank you to all of our guests who lend their ideas and expertise to these topics. A special thank you this season to Nicole Germo, our practicum student. Finally, we'd like to thank you, our listeners, for sharing your ideas and questions. Please keep writing us at publichealthquestion@jhu.edu, and thank you for being part of this podcast. Today, infectious diseases and cruise ships. Dr. Tara Palmore is an infectious disease physician in Washington, D.C. She speaks to Dr. Josh Sharfstein about norovirus, respiratory disease, and food-borne illness on the high seas. And she dispenses some wisdom about how to make your vacation more fun and less explosive. Let's listen.
Dr. Tara Palmore, it is so great to have you back on Public Health on Call. Today, we are talking about cruises. There are a lot of people planning cruise vacations, and we want to give them some useful advice. How does that sound to you?
That sounds great.
Now, you're an infectious disease doctor, so we'll be talking about some infectious disease risks, how the cruise industry tries to reduce those risks, and what individuals can do. How long is the list of infectious disease risks on cruises, Dr. Palmore?
Well, it's a long list, but a lot of the risk is concentrated on a few infections.
Let's start with number one, the infection that everybody worries about, literally going viral on a cruise ship, norovirus. So why don't you tell our audience, what is norovirus?
Norovirus is a virus that causes acute gastroenteritis. Norovirus is the dreaded virus that people think of when they think, what can I catch on a cruise ship? You can catch norovirus anywhere. You can catch norovirus at work. You can catch norovirus in daycare or school on any vacation. But we think of cruise ships because large outbreaks occur on cruise ships.
Tell me about the symptoms of a norovirus infection. What makes this a special infection?
Norovirus causes what we think of as a 24-hour case of vomiting, diarrhea, sometimes fever, body aches, and other symptoms, which can lead to fairly severe dehydration. And some people get quite ill, and it certainly can last longer than 24 hours.
And the length of time after you're exposed to norovirus before you get sick with norovirus, what's that?
The incubation period for norovirus, so the time between exposure and becoming ill, can range from 24 to 96 hours.
So if you're on a week-long cruise, it's quite possible that a lot of people could be exposed, and then different generations of people could be exposed. And before you know it, there are a lot of people who are throwing up and having diarrhea on the same cruise.
That's right. You can have explosive outbreaks, pun intended, in a setting where you have a lot of people in close quarters.
So this is well known, and the cruise industry tries to prevent norovirus. What did they do?
The cruise industry does a lot to try to prevent norovirus. And a lot of that involves really having sanitation of their vessels and maintaining high sanitary standards. And those standards are set by the CDC, and the European Union has standards as well. And the cruise industry has really every reason to follow high standards because they don't want these outbreaks to occur. So they try to prevent the outbreaks. And in fact, the rate of large outbreaks has declined over time. But things can go wrong when people bring infections with them onto a ship. And then, of course, when people don't follow behavioral guidelines.
So let's talk about those, because a cruise ship can clean very well, can be very hygienic, but you're still relying on people who have symptoms, who are starting to feel ill, to stay in their rooms and not show up at shuffleboard or the casino or the buffet and potentially expose a lot of people.
That's right. First of all, people are not supposed to even get on a cruise ship if they have any infectious symptoms. That's how viruses are introduced onto a cruise ship. Then when people develop symptoms, they're supposed to report them promptly to the medical clinic and follow instructions, not show up at shuffleboard or go in the pool. And really, people have to be intentional about doing that and then following the instructions, staying in their cabin until 24 hours after their last episode of vomiting or diarrhea, which is when they become a lot less infectious.
It seems hard because you're counting on people to stay away from all the fun when they paid all this money to be on a cruise ship. Who are the people that tend to not follow this guidance?
Well, yeah, it turns out to be a challenge for some people who really want to continue enjoying their cruise. We saw this a lot, during the COVID pandemic when people really were less considerate about self-isolating. And it takes, I think, very altruistic impulses to be able to put aside your enjoyment of the amenities on a cruise and self-isolate to avoid spreading an infection to other people.
Now, you were telling me before we started recording about a study suggesting one group that is less likely to follow the rules. What's that group?
Yeah, so there was a study based on a large outbreak that occurred on a ship. It was an outbreak that began when one person who was embarking on the cruise was seen to vomit in the middle of the embarkment area.
That's not a good sign.
It's not subtle, and it's not a good sign. And that actually sparked the outbreak that then affected 15% of the people on the ship. And what they found in the surveys of the affected people is that those people who had been on multiple cruises before that particular affected cruise were more likely than people who'd never been on a cruise before to continue participating in activities while symptomatic. So that was an interesting difference in likelihood to avoid self-isolating.
So the repeat cruisers might be less likely to follow the rules.
They might be the scofflaws.
All right, let's go to what people need to do to protect themselves from norovirus on a cruise ship. What are the critical things?
Well, the critical things, apart from the behaviors that need to be followed if people get sick, to protect themselves, number one is really hand hygiene. And that sounds obvious, and it sounds like you might just want to have a bottle of hand gel with you at all times, but it's actually a bit more complicated than that. So hand gel is alcohol-based. Norovirus is not inactivated by alcohol. Norovirus is a non-enveloped virus, which means that it doesn't have a viral envelope if you look at it through an electron microscope. Now, counterintuitively, that lack of an envelope makes it more resistant to disinfectants, including alcohol, and including standard cleaners, like the disinfectants found in floor cleaners and other cleaners that you might use to clean the environment on a cruise ship. So because it's so hardy, you actually need to clean your hands with something other than alcohol hand gel to protect yourself well from norovirus. So that means hand washing with soap and water. So that's the major tip. to protect yourself from noroviruses. Hand washing, especially after going to the bathroom, before eating, before doing anything where you might put your hands in your mouth.
That is a good tip. And we already had the earlier tip of to beware cruises if somebody throws up in the embarking area.
Yes. Watch for signs that are subtle and not subtle like that.
Let's move on from norovirus. What is another type of infectious disease risk that people should be aware about before cruising?
Well, I think COVID has been an obvious risk since the beginning of the pandemic. It remains a risk, but the dynamics have changed since most people have had COVID or been repeatedly vaccinated against COVID. Other respiratory viruses are a risk. I think it's hard to sum up the risk for everyone. I would just say that cruise ships are congregate settings. There is a certain risk for transmission, but the risk doesn't affect everyone equally. People should stay up to date on vaccination and, talk to their medical providers about risk factors for severe disease.
What do cruise ships try to do to reduce the chance of respiratory illness, including COVID?
Some cruise ships, until recently, were having people do COVID tests pre-embarkment. I'm not sure that that is still happening, though. When there are outbreaks of respiratory illness, cruise ships distribute masks, whether those outbreaks are due to COVID or other respiratory viruses. And then they have COVID tests, they have COVID treatments on board. I think they're fairly well prepared for respiratory virus outbreaks.
And for individuals, talk to your doctor, maybe bring a mask if you think you might need one, wash your hands, probably a good general piece of advice. Any other recommendations to avoid respiratory disease?
Yes, and vaccination, of course, COVID, influenza, and then RSV if that applies. And if you develop symptoms, wear a mask and see the medical providers on board.
Got it. So in addition to packing your suitcase, you should be optimizing your vaccine card before getting on cruise ship.
Yes, that I think would keep you the safest that you can be in terms of respiratory viruses.
All right, let's talk about one more risk on a cruise ship. Let's pick the risk of food-borne illness. What are we worried about here, Dr. Palmore?
So food-borne illness is fairly broad, and actually food-borne norovirus is another possibility that can occur during a cruise ship-wide outbreak of norovirus. But specifically, food-borne outbreaks of E. coli or salmonella can occur. There's often not a way to see those coming. But one thing that people can do to protect themselves from foods that are high risk for foodborne infection are avoid raw or undercooked shellfish. That's a big one. Those foods are often contaminated because oysters are filter feeders and concentrate bacteria and viruses from the water. So they really have a high rate of contamination. And then avoiding undercooked ground meat and avoiding undercooked chicken. Those should not be found in a cruise ship, but if you are biting into a piece of undercooked ground meat, don't eat it, or chicken likewise.
And cruise ships should obviously cook their food well enough. Are there rules that they have to abide by? And is there someone who judges whether they abide by those rules?
Yes, there is a vessel sanitation program run by the CDC, and the European Union has a similar program, which involves unannounced ship inspections. And those inspections take place about twice a year. And there are also guidebooks for ships that have a great amount of detail for ships to follow regarding food preparation and also just the maintenance of the facilities, maintenance of hygiene to prevent outbreaks of all sorts.
And recognizing that the responsibility for following these guidelines is with the cruise ship and that company itself. I'm just curious about enforcement. What happens if somebody helicopters onto a cruise ship? Maybe they don't helicopter, maybe they just show up, at port. But I want to think the most, exciting scenario for a public health person. They helicopter onto the cruise ship. They do the surprise inspection. What can they do if there's a big problem?
If a cruise ship has a big outbreak, there are steps that they can take. which include reinforcing their sanitation practices, obviously isolating patients, cleaning and disinfecting, all of the usual steps of an outbreak in any setting. And then, once the passengers have disembarked, they may delay embarkation for the next cruise and remove the ship from service, clean and inspect it. It's been shown that sending a ship out for the next cruise can be a risk factor for the passengers on that cruise unless the ship has been really sanitized.
Do you know how much transparency there is about inspections and the results of inspections for cruise ships? Is that something that someone who's going to go on a cruise ship could look up?
I'm not sure about the inspections, but I know that the CDC publishes the names of ships that have had outbreaks of a certain size on their website. So there's transparency about that.
Well, that's a place to start. That's good. Maybe worth double checking before you put in your credit card number. So, Dr. Palmore, I can't say I'm more likely to go on a cruise after talking to you today, but I can say I realize that people who do enjoy going on cruises can do a lot to keep themselves safe, and that the cruise ship industry has a lot to do too to make this really kind of like public health on the water.
That's right. I think that, if everyone followed the guidance, then cruise ships would really be pure fun and less disease.
Well, thank you so much for joining me. It's great to see you.
Thank you.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Grace Ceciri. Audio production by J.B. Arbogast, Holly Cardinale, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Ceciri and Eliza Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.